Hello guys, now we shall be discussing regarding one of the genitalia, external genitalia regarding the male reproductive system, that is the penis. Okay, so we shall be discussing regarding one of the external genitalia of the male reproductive system, so that one you call it as a penis. Now what is the structure, what is the use of this penis? It has got only two functions. There are only two important functions. So what are those two important functions? One is called as a sexual intercourse, another one is called as a micturition. One is called as a sexual intercourse, another one is called as your micturition. Micturition in the sense urination. So these are the two important functions. So if you look at this penis, we have got three important parts. What are those three important parts? You know, this structure which is lying down is called as your testis, right? So if you look at the penis, there are three important parts. This part which is shaded with the yellow, this is called as the root of the testis. This is called as the root. Next, this green color part over here is called as your body of the testis. Okay, body of the testis. And next, this part down over here is called as the glans penis. Okay, sorry, not the testis, the part of the penis. So this is called as the root of the penis. Next, this one is called as the body of the penis, and next this one is called as a glans penis. Okay, so these are the three important parts which we have got. Now if you look at the root of the penis, where is the root of the penis situated? The root of the penis is situated in the superficial perineal pouch. We will talk about it later on. Okay, but for now you just need to remember that the root of the penis is located in the superficial perineal pouch. Superficial perineal pouch, you have got the root of the penis. Second important thing, if you look at the overall penis root, right? So within the root of the penis you have got two important structures. Okay, so within the root of the penis you have got two important structures. So what are these two important structures? You have got three erectile tissues. Three erectile tissues which are responsible for erection, and next you have got two important muscles. You have got three erectile tissues and two important muscles. Now out of these three erectile tissues, two of them are called as crura of the penis and one is called as the bulb of the penis. Out of these three, you should call, two of them are called as the crura of the penis and one is called as a bulb of the penis. I'll show that to you in a minute. So one and two are called as a crura and one is called as a bulb. So if you can look at this, right? Now in this you can see two important structures. On the right as well as on the left you see the crura, and in the center you see that is called as a bulb. Okay. So that's what I was telling you. You have got three erectile tissues totally. So what are these three erectile tissues? Two of them are called as a crura of the penis and one is called as a bulb of the penis. Next important thing is that you even have got muscles. How many muscles are there? Two important muscles. So one muscle is called as 𝐒𝐼𝐼𝐼𝐿 muscle. One is called as 𝐒𝐼𝐼𝐼𝐼𝐿 muscle, and the next one is called as bulbospongiosum muscle. Bulbospongiosum muscle. So two important muscles over here. One is called as your 𝐒𝐼𝐼𝐼𝐼𝐿 muscle and the other one is called as your bulbospongiosum muscle. So these are the two important muscles that are located. Okay, so you have seen these three structures over here already, two crura and one bulb of the penis. Now I'll show you the muscles over here. So just look at this. This is a penis and you see there is a muscle that is completely surrounding the penis like a sling, right? Like a bulb like this, right? So this particular muscle over here is called as bulbospongiosum muscle. So this is your bulbospongiosum muscle. After this bulbospongiosum muscle, you see this particular muscle over here. After this bulbospongiosus muscle, you see this particular muscle over here like this, right? So behind that, after bulbospongiosus muscle, you see this particular muscle over here, all the way like this, here also, right? So this particular muscle which you can see over here is called as 𝐒𝐫𝐢𝐻𝐵𝐺 muscle. 𝐒𝐫𝐢𝐻𝐵𝐺 muscle. Anyways, even if you don't identify, then nothing is going to happen. Just remember that two important muscles we have got. One is called as a bulbospongiosus muscle and the other one is called as your 𝐒𝐫𝐢𝐻𝐵𝐺 muscle. Now after that, next important thing is that if you look at the body, what is a body? The green part is called as a body. If you look at the body, right, within the body you even have got three important cylinders that are responsible for erection. So within the body there are three cylinders. These are called as cylinders of erectile tissue. Cylinders of erectile tissue. So what are these three cylinders? So out of these three cylinders which you can see over here, now from outside, again don't confuse, from outside this is called as a right crest, this is called as a left crest, and this is called as a bulb. Now once you make a section and when you look from inside, don't think that these two are called as the bulb. So these two structures over here which are on the top, these are called as corpora cavernosa. There are two corpora cavernosa. So these are corpora cavernosa. And this yellow one over here is called as corpora spongiosum. Corpora spongiosum. Okay, so there are three important structures. So what are those three important structures? You have got two corpora cavernosa on the top, and down here you have got one corpora spongiosum. And within the center of the corpora spongiosum you see a small opening like this. This is the opening of your urethra. This is the urethral opening. Okay, so this is the opening of your urethra. So this is one of the important thing which you need to know. So there are three cylinders I told you. What are those three important cylinders over here? Out of these three cylinders, two are called as your corpora cavernosa. Corpora cavernosa, and one is called as your corpora spongiosum. So two are called as your corpora cavernosa and one is called as your corpora spongiosum. Right, now after this, the next important thing which you need to know. What is the next important thing which you need to know? The next important thing is that we need to discuss about the facial coverings. Right, what are the different kinds of fascia that are covering the penis? So that is very important. Okay, so to understand the facial coverings, I will draw one picture and then I will explain you. Facial coverings. Now coming to this facial coverings, first of all let us draw the outline of the testis. Now within this outline of the testis, what did I tell you? I told you we have got two important structures. Outside you have got two cylinders called as corpora cavernosa. In the center you have got a cylinder called as corpora spongiosum. Let us say this is the overall structure of your penis. So this structure which I am drawing right now is the urethra in the center. Okay. Now what is the important thing? I have already told you that you have got corpora cavernosa as well as corpora spongiosum. So this part on the section is called as corpora cavernosa. Okay, so you'll understand now. So let me highlight it. You see this yellow color part which I'm highlighting right now, this is called as your corpora cavernosa. This is called as your corpora cavernosa. After this corpora cavernosa, the rest of the part, whatever you can see over here, this is called as your corpora spongiosum. Okay, the rest of the part whatever is there here, this is called as your corpora spongiosum. So let me write it down. Now you might think, sir, there must be two corpora cavernosa and one corpora spongiosum. So one corpora spongiosum is fine. Then where are two corpora cavernosa? See, very important thing that, for example, let me put these two structures over here, right? So let us say this is one pen, right? These are the two pens over here. Okay, these are the two pens over, or else let me show it to you in this way. So let us say this is your corpora cavernosa. This is another corpora cavernosa. So two corpora cavernosa, where are they? They are on the top. And down here, what do you have? Down here, I have got corpora spongiosum. Okay, this is the structure, right? So two corpora cavernosa on the top. Down here, I have got this white color corpora spongiosum. Now, if you are looking from the side, how many corpora cavernosa can you see? You can see only one corpora cavernosa. And how many corpora spongiosum? Obviously, you can look at the corpora spongiosum down. Above, what do you have? Corpora cavernosa. But can you see the corpora cavernosa which is present on my side? You cannot see. So from the side view, what you can see, on the top you can see corpora cavernosa, which means this one. This is corpora cavernosa, which is in yellow. Down here, what you can see, which I have highlighted with the orange here, this is called as your corpora spongiosum. Okay, so these are the important thing. So let me write it down, that this particular structure over here is called as your corpora cavernosa, and this is called as corpora your corpora spongiosum. Now after this discussion is done, second important thing you need to know. What is the next important thing? That I have already told you, you have got a very specific muscle, and that muscle is called as bulbous spongiosus muscle. So this is the muscle that is located over here. You see this particular muscle which I have highlighted? This particular muscle over here is called as your bulbous spongiosus muscle. Bulbous spongiosus muscle. Now let us discuss about the fascia. Now the first important fascia, let me draw this fascia with the pink color. The first important fascia starts surrounding your bulbous spongiosus muscle. So this is a fascia. So this is a fascia that is surrounding your bulbous spongiosus muscle. Now this fascia is continuing down, and here you know that you have got your testis, right? And this fascia even continues all the way along this glans penis like this. Okay, so this is a fascia that is continuing down, and this fascia comes all the way down, all the way onto the top of your corpora cavernosa, right? And this fascia slowly it is transforming into a red color fascia, you see. So what is this? First of all, what is this pink color fascia over here? So this particular pink color fascia is what is called as your Colles fascia. So this one over here is called as your Colles fascia. Okay. After Colles fascia is continuing as what? It is continuing as Scarpa's fascia. What is Colles fascia continuing as? Scarpa's fascia. Okay. Now this particular Colles fascia is surrounding your testis. Yes, the place where the Colles fascia is surrounding your testis, from here all the way till here. So this part of the Colles fascia you called as tunica dartosus of scrotum. So this is called tunica dartosus of scrotum. This is called as your tunica dartosus of your scrotum, right? Now the next important thing is that there is one more fascia here. Where is this fascia? This fascia is lying deep to the Colles fascia, which means this fascia which I am drawing with the blue. You see this particular fascia which I am drawing with the blue, that is lying deep to this Colles fascia, right? So this particular fascia is called as your Buck's fascia. Okay, so this particular fascia which I have drawn with the blue is called as your Buck's fascia. So one is called as your Colles fascia and the other one over here is called as your Buck's fascia. Okay. Now next important thing is that surrounding this corpora cavernosa you have got a layer. Okay. So how do I draw that layer? I'll draw it with the green. Surrounding this corpora cavernosa, you see a green color layer which I am drawing, that is completely surrounding this corpora cavernosa. So this layer which is surrounding your corpora cavernosa is called as Tunica albuginea. What is this particular layer called as? This layer is called as Tunica albuginea. Okay, so this particular layer is called as Tunica albuginea, right? So these are some of the important facial coverings which you need to know. So here what are the two important facial coverings which we have seen? We have seen one is called as a Buck's fascia, right? That is a fascia which is completely deeper. The first fascia we discussed is the Colles fascia. Colles fascia continued as Tunica dartosus of the scrotum, which in turn continued as Carpa's fascia. Deep to that we have seen the Buck's fascia. And you also see a layer that is surrounding the corpora cavernosa, that is called as Tunica albuginea. Okay, right. Now what we shall see is that we shall discuss the same important things but along with some arteries and veins also. What we'll do is that we will make a transverse section of this. Okay, so after making a section I will draw all the structures over here. Now here very clearly you can see where are corpora cavernosa as well as corpus spongiosum. Right, corpora cavernosas, the two corpora cavernosas and one corpora spongiosum, all these things you can see over here. So let us discuss now. So let me draw this oval part like this. So this oval part which is not at all oval, let us say this particular part which I have drawn over here represents the skin. Okay, so what is this layer? This layer is representing the skin of your penis. Okay, just beneath the skin layer you have got another important fascia called as superficial fascia. Okay, so what is this? Repeat. You have got another important fascia over here and this fascia over here is called as your superficial fascia. So let me put that superficial fascia over here. Yeah, so this is your superficial fascia. Okay, so this fascia which I have drawn with the green over here is called as your superficial fascia. So the next layer is your superficial fascia. After the superficial fascia, you have got another layer which is completely yellow and that layer is called as areolar tissue. After that, I will draw the areolar tissue later on, but after that areolar tissue, you need to know another important thing that is called as a deep fascia. What is a deep fascia here? Deep fascia is also called as your Buck's fascia, right? So let me draw the deep fascia over here. Yeah, so this particular part over here is called as your deep fascia. Now, where are your corpus cavernosa as well as corpus spongiosum? So you see very important things over here. See, here you see two eyeball like structures, right? So here there is one structure over here. And here you have got one more structure. So these two structures over here are called as your corpora cavernosa. Now after corpora cavernosa, you have got the next important structure here down. This is called as corpora spongiosum. So two corpora cavernosa and one corpora spongiosum. So this one over here is your corpora cavernosa like this, right? So here also you have got your corpora cavernosa. And down here you got this is called as your corpora spongiosum. So what are these structures over here? This is called as your corpora cavernosa and corpora spongiosum. Corpora cavernosa, and this one over here is called as your corpora spongiosum. Corpora cavernosa as well as corpora spongiosum. Now in the center of this corpora cavernosa, you have got an artery. This artery is called as a deep artery of corpora cavernosa. So within the center of corpora cavernosa, you have got an artery that is called as what? That is called as a deep artery of corpora cavernosa. In the center of corpora spongiosum, you have got a structure in this way, right? So this particular structure is called as your urethra. Okay, in the center you have got what? In the center you have got urethra. And remember one thing, that this particular fascia, whatever you can see, what is this fascia? The deep fascia, right? Deep fascia is also called as your Buck's fascia. The deep fascia or Buck's fascia. So this deep fascia or Buck's fascia, actually it completely surrounds your what? It is completely surrounding your corpora spongiosum. Okay, so this Buck's fascia completely surrounds your corpora spongiosum. And remember not to forget one thing that I have already told you in this previous picture, that corpora cavernosa is surrounded by what? It is surrounded by Tunica Albuginea. So here also let me draw the same thing. Corpora cavernosa on both the sides is surrounded by Tunica Albuginea. Okay, so on both the sides it is surrounded by what? It is surrounded by Tunica Albuginea. Okay, right. So what are the layers from outside to inside? So outside, the first layer which we have got is the skin. Okay, this is the first layer. Now after the skin, the second important layer we have got is the superficial fascia. Superficial fascia. The third important thing after that we have got is the areolar tissue. I will show it to you now, areolar tissue. And the fourth important thing is the deep fascia or Buck's fascia. Deep fascia, or you can also call it as a Buck's fascia. And the fifth important thing is your Tunica Albuginea. Tunica Albuginea. Okay. Now where is this particular Buck's fascia over here? Yeah. So this is the perfect location of the Buck's, sorry, not the Buck's fascia, the areolar tissue which I told you, right? So this is your areolar tissue. So this particular tissue over here is called as your areolar. So the third important thing, this particular tissue is called as your areolar. Okay, and this center part over here is called as your urethra. This is called as your urethra. Right. Now next important thing is that let us look at the blood vessels over here. So here you have got a vein. Okay, even in the areolar tissue also you have got a vein. Now out of these two veins, which is superficial? So this one over here is called as superficial dorsal vein. This is called as superficial dorsal vein. Now if that is superficial dorsal vein, then this one over here is called as deep dorsal vein. So one is your superficial dorsal vein, another one is your deep dorsal vein. Next, side to it, you have got two arteries over here. These are called as dorsal arteries. Side to that, you have got two nerves over here. These are called as dorsal nerves. Okay. So this one over here is called as dorsal artery, and this one over here is called as your dorsal nerve. Okay. So what are the important structures over here? Superficial dorsal vein, deep dorsal vein. You have got dorsal artery, you have got dorsal nerve. Okay, so these are the structures which you can see over here. Now these are the structures I want you to remember all the way from outside to inside: skin, superficial fascia, areolar tissue, deep fascia or Buck's fascia, Tunica Albuginea. Right, second important thing is that let us discuss about what are the different ligaments. What are the different ligaments of the penis? Right, now before knowing the ligaments, let us draw these ligaments from the side. Okay, so from the side view, let us say that this part of the bone is your pubic symphysis. Attached to the pubic symphysis, you have got a ligament like this. This is called as linea alba. Okay, what is this particular thing over here? This is called as linea alba, and this is called as your pubic symphysis. So one is your pubic symphysis, another one is your linea alba. Now all of you know this is your penis. This is your penis all the way, right? You have got urethra in the center. You have got the urethra in the center. Now, important thing is that from the pubic symphysis, if you look carefully, there is a ligament that is attached to the dorsal surface of the penis. Okay, so this particular ligament is called as your suspensory ligament. So, what is the name of this particular ligament? This particular ligament is called as suspensory ligament. Now, after this suspensory ligament, from the linea alba also you see a ligament that is coming down, and this ligament is surrounding the penis like this. You see, this is the ligament that is coming down all the way from linea alba, and this ligament is surrounding the penis like a sling, and it is going and attaching back to this linea alba. So this particular structure over here is called as fundiform ligament. So this particular structure over here is called as fundiform ligament. So two important ligaments over here. So what is the first ligament? One is called as a suspensory ligament, and the next one over here is called as your fundiform ligament, right? Now only two ligaments we have got, suspensory as well as a fundiform ligament. So coming to the arteries, I have already told you that we have got the dorsal artery, we have got the dorsal nerve. Apart from this, there are also few more arteries that are supplied here. So actually there are three important arteries over here. What are those three important arteries? One is called as the dorsal arteries of the penis. Dorsal arteries of the penis. This is one important artery. Next artery is the deep arteries of the penis. Deep arteries of the penis. And third important thing is the bulbourethral artery. Bulbourethral artery. And remember these things, that all these three arteries they supply to the penis, and all these three arteries are the branches of internal pudendal artery. Internal pudendal artery. Okay, so this is all you need to know regarding the structure of the penis, guys. So thank you so much for watching my video. Goodbye.